I think we're going to go ahead and get started. Everyone, again, welcome to our webinar today on longevity. We're so excited to have you. Please note as you entered our Zoom meeting room that your lines have been placed on mute. And that we ask that you please do engage with us, throughout the webinar by using the chat box. We'll be looking for your questions and comments as we move through the content. If for some reason your line is not on mute, if you could go ahead and mute yourself, that would be terrific. And also just to let you know that we are recording this session and you will receive a link to it following today's presentation in the next day or so. So you'll get a link with the presentation and some additional resources. So again, welcome. My name is Gina Messina, and I'll be moderating our panel today. And we have three super amazing panelists who you've likely heard from before. Stacey O'Brien, who is the Assistant Professor of Social Work at Ursuline College. Lynn Yoledakowski, who is our Assistant Professor of Biology, and Anne Murphy-Brown, who is the Director and Associate Professor of Legal Studies. So we are going to go ahead and get started hearing from Lynn about questions related to nutrition. So Lynn, the last time we talked about personalized nutrition, you discussed the differences between contemporary and traditional approaches and shared how they provide a framework for a healthy diet. I really love this image because I think language is so powerful and really important for us to think about how we're using words and how we respond to that. And so this is such a great demonstration of it. So talking about the word diet, what do you think about this statement that diet is a noun and not a verb?
Yeah, I think that's a great clarification. So let me go ahead and clarify that for you, Gina. Diet is often used as a verb, as in to diet, but really we should be using the word diet as a noun, indicating a more complete, holistic lifestyle. And it bears repeating that food fuels body and is really the foundation of health. And we really need to think of food as medicine because nutrition and lifestyle changes can have a huge impact on disease. In fact, 50% of the top 10 chronic diseases like heart disease, Alzheimer's disease, and diabetes can be directly influenced or treated with nutrition. Research has shown that consuming a combination of 5 servings of fruits and vegetables per day can decrease the risk of cardiovascular disease, cancer, as well as respiratory diseases by as much as 35%. And to get an idea of how nutritionally well you're doing, consider taking a nutritional assessment like a general evaluation called Determine, which is a nutrition checklist, or trying to use a food app to specifically assess nutrient intake for a couple days. And I use Chronometer, which is a great app. It's free and it's easy to use.
Wonderful. Thank you so much, Lynn, for that information. Very, very helpful. And right now we're going to move on to Stacey to talk a little bit about some of the things that she covered in a previous discussion related to long-term care or LTC continuum. Stacey, I'm wondering if you can talk a bit about programs and policies that could pay for LTC services, specifically Medicare and Medicaid, which I think are two terms a lot of us get confused and don't fully understand. So while we both know that both are complex federal policies, are there situations where Medicare will cover long-term nursing home care? And if the person's income is below a certain level, will Medicaid pay for some of those expenses?
Gina, you're definitely right. These are two complex policies, and I'll just talk a very little bit about them today. Unfortunately, many people mistakenly believe that their Medicare will be all they need to take care of their health as they age. Without looking into the limitations of these benefits, older people in need of support are often disappointed to learn that their Medicare doesn't really provide a whole lot in terms of care. We're going to talk a little bit today about some of the main policies and sources of funding for care in older age. Medicare is a federal policy that is, I remember by thinking about Medicare as care for the elderly. Eligibility is limited to those who are 65 and older or who have been disabled for 2 or more years, although there are some exceptions to the disability rule. Medicare is available as traditional Medicare, which are parts A and B. Part A covers hospitalization and inpatient services, and Part B covers lab work and doctor's visits. Or you can choose, rather than traditional Medicare, parts A and B, you can choose what's called a Medicare Advantage plan, which is like an HMO. It's called, in the Medicare world, it's called Medicare Part C. And then finally, the newest part of Medicare is Part D, which is the prescription drug plan. Both traditional Medicare and the Part C Medicare Advantage plan specifically exclude long-term nursing home care, personal care, and custodial care, like homemaker services, from coverage. In Cleveland, the average cost for a long-term nursing home bed is about $7,000 a month, with many places as high as $12,000 a month. So basically, Medicare covers virtually nothing on this continuum other than short-term stays in a skilled nursing facility and short-term skilled home health care. Hospice services are also covered, but I did not include those on the continuum. There are lots of new rules, which I think I spoke to the last time we met, in terms of the Part C Medicare Advantage plans. They are covering more and more for Medicare eligible older adults. Some plans even cover transportation, limited home delivered meals, and even medical alert systems. So if you do have an Advantage plan, check to see what other benefits are covered. And then Medicaid, I remember by telling myself that Medicaid is aid for the poor. Medicaid is a joint federal and state program, which means unlike Medicare, the rules will be different state to state. Many people can't afford to pay for long-term nursing home care and rely on Medicaid to cover their stay. To qualify for Medicaid, you must have an income at or below a certain amount each month and also have limited assets. There are very detailed rules about Medicaid and how to qualify for Medicaid. So if you have assets now, but anticipate you'll run out of them if you need nursing home care, then you should really talk to an attorney about how to protect your assets to the greatest extent possible. Medicaid in Ohio covers the programs that are on the slide now for those who meet both financial eligibility and other care criteria. If you live outside of Ohio, you should check the Department of Medicaid in your state to understand your specific state's eligibility guidelines.
Stacey, wonderful. Thank you. That's so helpful. Like I said, so many of us confuse those two particular plans, myself included, by the way. So it's really good to have a breakdown of that information. And next, we're going to turn to Anne. Anne, you are full of information that is just so critical. And I just want to say how much I love the article that you wrote on the Women Wellness Work website about longevity and your experience with your own dad. So it was so personal and beautifully written, and something I think so many of us can relate to that really connects with these ideas in needing to be prepared. So the last time we talked, you took us through wills and probate. And today, it would be great to hear from you on the top 5 estate and life planning documents. So I know specifically it would be great to hear from you on the first 2 right now, wills and trusts. So what are they used for and how are they different?
Hi, everyone. Thanks so much, Gina, for that introduction. So yes, to a little bit about myself, I'm an attorney, but also how I really got invested into this type of planning is my elderly parents really needed a lot of help. And so I have personal experience with sort of having to take over someone else's finances and plans, particularly as my dad was afflicted with Alzheimer's before he passed away last summer. So the two basic documents that you're going to hear a lot about, from attorneys or on TV or from friends or whomever, are wills and trusts. So what are they? How are they different? A will is a legal document that sets forth your wishes regarding the distribution of your property and the care of any minor children. So why do I need one? If you die without a will, those wishes may not be carried out. Further, your heirs may be forced to spend additional time, money, and most of all, emotional energy to settle your affairs after you're gone. If you have minor children, you absolutely have to have a will, because then the state steps in and, or without one, the state will step in and try to figure out where you want your kids to go. And no one wants their children to go through something that difficult. But a caveat is that not all assets are subject to a will. As I talked about in our last presentation, any co-owned property that's held properly in trust, and property subject to contract. So for example, your life insurance or your investment accounts will pass to the beneficiaries that are listed and are not subject to a will. So what is a trust then, and why do I need one of those? A trust is a fiduciary relationship in which one party, called the trustor, gives another party, the trustee, the right to hold title to property or assets for the benefit of a third party, who's the beneficiary. So a trust can really be used to determine how a person's money should be managed and distributed while that person is alive or after their death. A trust avoids taxes and probate. It can protect assets from creditors, and it can dictate the terms of an inheritance for beneficiaries. The disadvantages of trusts are that they require time and money to create, and they can't be easily undone or revoked. The best thing about trusts is they're extremely versatile. There's a lot of different types of trusts. So this is an area where you really need to consult an attorney to determine the best type of protection, asset protection particularly, that you need through a trust. So do I need one? It depends. They do provide legal protection for your assets, and also provides for the distribution, but it's really going to depend on your own personal needs and, your circumstances. So let me give you an example of when a trust might work really well. So let's say a family owns what is known as sort of a legacy second home, a beach home that's been passed down through generations, and the parents want the home to stay in the family, but there's concerns with the finances or the life choices of some of the children. They establish a family trust to hold the property with the 5 children as beneficiaries. A neutral third party can act as the trustee and maybe even for a small stipend each year. Clauses within the trust will dictate how the property is to be maintained and under what circumstances the property can be sold. Creditors of the children then can generally not reach into the property because it's held by the trust. In particular, if any of the children are subject to divorce proceedings or something, it can still retain that property in the trust for the 5 beneficiaries. So that's when, a trust, you can see how versatile it is, and it goes beyond just regular estate planning. It really can help with what's going on in your life. So thanks.
Wonderful. Thank you so much, Anne. That's such important information. We're going to go ahead and move back to hear from Lynn now. Lynn, we know that we need nutrition because food fuels our bodies, and it's the foundation of our health. So we know diet, the word as a noun, and lifestyle changes can make significant impact on disease. In our first session, you talked about using food as medicine, such a critical concept. I'm wondering if you can tell us about some of the challenges we face when trying to obtain our nutrients, specifically nutrients of concern. What are some things that we should be focused on?
Yeah, those are great questions because many people over the age of 65 are either undernourished or overnourished. And among those older people living in their own homes, about 1 in 10 live with undernutrition. And many older adults report that they skip at least one meal per day. For people over age 65 who become hospitalized, their risk of becoming undernourished may rise as much as 60%. And furthermore, up to 85% of people who live in long-term care facilities experience malnutrition in some form. And then on the other end of the spectrum, as much as 1/3 of people over the age of 65 suffer from overnutrition. That is essentially they eat too much and don't get all the necessary nutrients they need. The result of overnutrition is high rates of being overweight and obese for this age group. So what the challenge really is as we age, we need to obtain all the nutrients in the limited amount of calories our body needs, which is really sometimes nearly impossible. Thus, we really need to focus on nutrient-dense foods. And some of the challenges also are as we age, we have difficulty eating. Eating is a social environment kind of activity, and there's less social activities as you become older. Sometimes medication blocks absorption of nutrients. It's difficult swallowing, or you have digestive issues that block the absorption of nutrients. Food tastes different. There's different access or less access to foods. So a lot of things can also combine to have negative effects on being able to reach all our nutrient goals. And because of these changes and these challenges that we face as we get older, there are definitely some nutrients of concern and interest that we need to be aware of as we age. And it's really important to note that many of these nutrients, we don't even get 1/4 of what we need. So vitamins E and D and K and calcium and magnesium, we don't even get 25% of those nutrients that we need. So the nutrients that are really of concern that we should concentrate on getting enough of as we age, the first one is protein. Protein combats that loss of muscle mass, which is called sarcopenia. And we can get their protein by, the best choices are plant-based grains as well as lean meats. A second thing we should really be concerned about are B vitamins. And I'm sure you've heard that a lot of older adults are on B complex vitamins. And that's because B vitamins naturally decrease in absorption in the intestines as we age. This can lead to a decline of cognitive function. Some places that are really good sources of B vitamins include fish, chicken, grains, as well as fruits. And we can't overlook water. Obviously, water has no calories and it's really a star. It prevents dehydration and aids in digestion. If you don't like just drinking water, you can get water from other fluids like tea or non-caffeinated items, as well as fruits and vegetables. But I would caution to avoid sugary drinks and alcohol to fulfill your fluid needs. And I should note that being thirsty is not an indicator of fluid needs. And as you may know, diuretics and bladder control or lack of bladder control can definitely affect your fluid intake. Some other nutrients also to be aware of and be interested in as you get older are calcium and vitamin D. Calcium absorption naturally decreases due to decrease in stomach acids. A lack of calcium can contribute to osteoporosis, as I'm sure you've heard many people have the broken hip as they get older. And the best source of calcium is dairy products. And if you are going to take those dairy products, I'd really concentrate on low-fat dairy products. Vitamin D, which is sometimes difficult to get in our latitude, is a good source of vitamin D is sunlight. And because elderly are often outside less, they don't receive that vitamin D from the sunlight. Vitamin D or lack of vitamin D contributes also to osteoporosis like calcium, as well as a weakened immune system. I would concentrate on fortified foods and fish to get that vitamin D. And then finally, look for fiber. Fiber helps with digestive issues, as well as foods that have fiber are usually better quality. They're higher in vitamins and minerals, so they are more nutrient-dense foods. So overall, you should emphasize nutrient-dense foods. So in other words, the more whole and less processed, the more nutrient-dense your foods are going to be. Look for low-fat dairy products. Decrease your saturated fat, which are your bad fats and contribute to disease. And increase your healthy fats like oils, plant fats, and nuts. And finally, choose foods with lower sodium in them.
Lynn, thank you. That's such great information, and I love that that you're sharing this with us. And a trick that I've heard of that I'm sure many of us have is if we can just shop the perimeter of our grocery store, we will find what we really need rather than entering those aisles and have all the packaged processed stuff that, you know, is easy to sneak into our diet, although we shouldn't be. So great info. And I'm always trying to get enough water. And I find that if I put frozen blueberries in my water, I drink a lot more. So just a comment I wanted to share. Thank you. And now we're going to move back to Stacey. And Stacey, you know, we've talked about a lot of different funding resources and related to long-term care. But I'm wondering if you could focus on now a little bit about long-term care insurance. I know that Anne mentioned it in a previous session, and I'm wondering what you could share with us about what a long-term care insurance policy could cover and why it might be important.
Sure. Long-term care insurance can be purchased to pay a portion of your long-term care costs once you meet the policy requirements to receive the care. You will pay an annual premium for the policy, which can be quite expensive depending on your age and where you purchase it. You should definitely shop around if you are looking for one. A long-term care policy will often provide a per diem. So they're going to pay a daily rate for your services. And they cover things like home health care. So if you wanted to hire an aide to come and be with you for 4 or 5 hours a day, that might be something that a long-term care policy would cover. They may cover adult daycare, assisted living, or nursing home care. It is very dependent on the policy you purchase. And policies vary significantly as to what kind of services they cover, the per diem rate that they cover, and the criteria that they require before they will initiate coverage. So in looking for a long-term care policy, it will be very important that you're reading the policy closely to understand all those different criteria for it. If you already have a policy, pull it out, take a look at it, and use it as a guide to help you make decisions about the kind of care you need. So your existing policy may offer some guidance to you in terms of whether they would cover adult daycare versus home care. And that may help you determine whether you want to stay at home or go out each day and go into a daycare setting and then be returned home at night.
Thank you, Stacey. That's really great info. Another topic that I've heard some questions about, and I've been curious about, is the Older Americans Act. What can you tell us about that?
The Older Americans Act is a federal policy that is supposed to be reauthorized every 5 years. It funds services and programs with the goal of keeping older people independent in the community. So they're focused on providing services and programs in the community and not in facilities. Federal dollars go to state departments on aging, and then the state departments on aging distribute those dollars to the regional area agencies on aging. Those area agencies then send out a request for proposals from service providers, and they give grants out to provide the actual services. Our regional area agency on aging is the Western Reserve Area Agency on Aging that some of you may have heard of. It covers Cuyahoga County and 4 other counties. You'll find Older Americans Act services in lots of different kinds of places. So you might find them in senior centers. Some YMCAs use funds from the Older Americans Act. Nonprofit aging organizations use them. And they cover things like transportation, congregate and home delivered meals, caregiver support, and job training. They also are focusing more on evidence-based programs that promote health and help older people live longer with chronic health conditions.
Thank you. Thank you for sharing that. So very helpful. We're going to switch our conversation back to Anne right now. And Anne, I think we all know that it's hard to plan for all scenarios. And of course, the pandemic has really highlighted that for us. So in the event that you're unable to make a decision for yourself, how can a power of attorney be helpful with that? And how is that different from a living will?
All right. So a power of attorney is at its core a legal document that gives one person, an agent, the power to act for another person who's known as the principal. The agent can have very broad legal authority or very limited legal authority to make legal decisions about this person's, about the principal's property, finances, or even medical care. And we'll talk about how that one is different in a little bit. A power of attorney is frequently used in the event of a principal's illness or disability, or when the principal can't be present to sign necessary legal documents for financial transactions. So when my parents were getting older, this was one of the things that we stepped in very, when my dad was still clear and my mom was fine, we stepped in and had them execute a power of attorney. And in fact, when I look back at some of their legal documents, they had these back in the 90s with me as power of attorney should something happen. So it was just in case they needed someone to step in. It's really important for someone who doesn't have a spouse, for example, who can step in and easily manage someone's affairs if something should happen. So if you're dealing with, the elderly or an elderly widow or widower, they should really choose a trusted person to have power of attorney over financial affairs should the need arise. And also it's important to note that these kinds of powers of attorney can be also used for a limited purpose. For example, several years ago, my sister was living abroad and was getting ready to move back, and her husband and her had chosen a house online. And they executed a limited power of attorney in order for me to sign all the paperwork for them to purchase this house in the States. So you can use them for a limited purpose as well. Where you really need to use one is something known as a durable power of attorney for healthcare. And this is a document where you don't need an attorney. These are online through the Ohio Hospital Association, through AARP has resources for every state. But if you're here in Ohio, this is something that the Ohio State Bar Association, Ohio Hospital Association, Ohio Department of Aging collaborated on, and it's a form. So this durable power of attorney for healthcare lets you name someone else to make decisions about your healthcare in case you're not able to make those decisions yourself. It gives that agent instructions about the kinds of medical treatment you want. And you don't need to have an attorney to do this. You just need to have somebody witness you sign it. and it becomes, available. It's something you should keep with your important records. So why do I need one? This will allow someone to make decisions for you if you can't. And when you're in that situation, you do need to have a trusted person. It really is designed to kick in only if you're incapacitated. So it's just a fail-safe so that your wishes are met. But the other thing that you can have is a living will. And what this does is it's a written legal document that spells out the medical treatments that you would and would not want to be used to keep you alive, as well as your preferences for other medical decisions. So such as pain management or even organ donation. The things that you'll have to consider in putting forth this document would be CPR, ventilation, being on a ventilator. We've heard a lot about that over the last year. Any tube feeding, dialysis, antibiotic or antiviral use, comfort care, which is palliative care, organ and tissue donation. And if you wanted to even donate your body for scientific study, all of this can be spelled out in a living will. And again, this is a document that you don't have to create. The AARP has resources for every state, and the Ohio Department of Aging and the Ohio State Bar Association, Ohio Hospital Association has form living wills that you can use. So really these two documents, the durable power of attorney for healthcare and the living will, work together in conjunction, because one spells out your wishes and one gives you have somebody making sure those wishes are carried out. So it's important to have both. And what I want to just stress is that whenever you're doing estate planning or these kinds of documents, this is not something that you set and forget. The best thing you can do is find a trusted legal professional and revisit these important documents as your life progresses. So issues that I may have had 10 years ago, I won't have 10 years from now. I'll have new issues that I want to make sure that I'm protecting my assets in a certain way. And there's even some apps that you can use to keep these things straight. So for example, there's one where you can store your medical documents and information, including your durable power of attorney for healthcare and living will, right on your phone. And it's called Milo, Mind Your Loved Ones. So these are the kind of technology innovations that are going to help us manage these kind of documents as life goes on. So thank you for letting me speak on these important topics.
And thank you so much. I mean, such a wealth of information and things that we really need to know about and be considering, as you said, at any stage in our lives for ourselves and for our loved ones. So thank you to Anne, Stacey, and Lynn for this wonderful information. And I want to share with you that they put together these really terrific resources for you, which again, we'll be sending out to you in an upcoming message. So you'll have easy access to it. And right now, I'd like to take an opportunity for us to open up to some questions or comments that you might have. So the chat is open. Please feel free to share your message in the chat. And also, if you'd like to unmute yourself and share your question that way, you are welcome to do so.
While we're waiting for a question, I think I missed one very important thing when I was giving my advice. Never self-medicate. I talked about these nutrients of concern and interest as we get older, but it's never a good idea to self-medicate. And I always encourage people to have this information and then speak with their doctor. And another thing that, when people want nutrition advice, they tend to go to the internet to find, sort of what they want to see. And I would use these resources that I laid forth for you, because a lot of the information that you find on the internet is obviously not true. And secondly, it's very vague. And it's disappointing to people when they get this vague information because they want answers. But really, everyone's has personal needs, and that's why you have to take the education that you find on the internet and combine it with an expert in the subject, like a clinician that can help you fulfill your specific needs.
Thank you for that, Lynn. I think, again, that's really important information. And I wonder if you could just follow up on that a little bit with, ensuring that we're getting our nutrients. Why might it be important to take a multivitamin daily, for instance, rather than doing different supplements?
Right. Yeah, so that's a great question that goes along with everybody has personal needs, and some of those things on the internet that you find that might be a little bit shady. But when you take a multi-mineral multivitamin, you're less likely to become toxic because you're taking a reasonable amount of everything. And your body has a great filter on it that says, well, I need this, I don't need this. And you might have heard the term expensive urine before. And basically that means that your body is going to take in those extra vitamins and just excrete them out. It doesn't do this for all vitamins, but the important thing is, if you take a multivitamin, multimineral, you're less likely to have adverse effects like toxicity. When you just pick and choose and take one vitamin or mineral, you're more likely to have toxic effects. And so the only way that you would know that you really need to just take one, like for instance, a lot of people in this latitude, like around Cleveland, need to take vitamin D because we don't get a lot of sunlight during the summer. But I still would advise you to get the help of a clinician to actually prescribe that.
Great. That's so helpful. Thank you. Do we have some additional questions? I see here Shirley says, thank you for the great resources.
I have a question regarding the nutrients, proteins, and so forth that you had shown on the chart earlier. Most of it was protein. When you talked about the protein, the vitamins B and D, and you had also mentioned, fish as good sources for that and so forth. Yeah, I get it. Fish and chicken are definitely better than beef. I mean, we've cut out beef for a long time, and they're more nutrient dense foods, like the nuts and so forth are definitely more nutrient dense. But at that age group, so I'm 62 now, and my husband's a little bit older than I am. So at our age group, we really don't metabolize those dense foods like we did 10, 15 years ago. So what are your recommendations for still getting those proteins, but not gaining weight?
Yeah, that's a great question. So the leaner the protein, the better. So when you say you can't metabolize those foods, are you talking about animal-based foods or the plant-based foods? I wasn't clear on that.
Well, as we get older, our metabolism slows down. So at 60 and later 60s, it's definitely slowed down from what it was, 10, 15 years ago. And at our age group, we can't exercise to get our heart rate up as high as we did 10, 15 years ago. So we're naturally stuck in this place where, our bodies demand the protein to keep up the muscle. Mm-hmm. However, we don't metabolize the foods going in as we used to. So what's the solution for that? Is there,
right?
You're
absolutely
they talk about it. They always talk about for the 30 and 40 and, touching on the 50-year-olds. But once you hit 60 and 70, that's a whole different ballgame. And nobody addresses that.
Right. Yeah, you're absolutely right. And, I hate to say that as we age, it's almost impossible to get all your nutrients with foods. There's actually research that is just in press right now that's going to be coming out soon. But I just watched a talk on this. You need at least about 1,400 calories per day to be able to get all your nutrients that you need. Now, as you said, because your metabolism decreases, you aren't using all those calories. And so the key is really to get as many nutrients dense foods as you can. So with respect to protein, if you could eat the lean red meats, they're a great source of protein. So when I say lean red meats, I mean meats without the fat on them. So, red meat gets sort of a bad rap, but if it's lean red meat, it's okay, because you're not the fat or the bad fats come from the saturated fats, the white marbling that you see on them. So if you have lean red meats, that will give you protein as well as iron, a good source of iron. The same thing with meats, other meats and fishes, that will help you get your protein as well. And so, you might come to a point that you definitely do need specific nutrients or a multi-mineral, multivitamin, but nutrient dense foods are the best way to get your increased proteins and increased nutrients that you need. I would say you should look at that women's health resource that I gave. It's a checklist of things that goes by every decade of life. So that might help you for the 60s and the 70s, as well as chapter 6 of the Dietary Guidelines of Americans that just came out, also has resources for as you age. And this is totally new for the Dietary Guidelines of Americans. They've never split it up into different life stages before.
Okay, yeah, because also in our age group, we're hitting on cholesterol issues. So once again, with those meats, the animal, there's the cholesterol problem. So, and then you go to nuts or other proteins, and the density is way up there. For example, my BMR is 1404. So there's not much leeway. I mean, you would give in a number 1400 for the, for the intake. And when your BMR is 1404, I mean, you're cutting it really close for your caloric intake daily. And, what is it, 3,200 or 3,500 calories is a pound. But when you're only going to be able to metabolize 1404, it's like it's like a spiral. It's a really hard game to keep at, which makes diet a verb.
You're absolutely right. You're walking the fine line there. And I'd love to talk more about this, and you could definitely reach out to me. But I don't want to keep anybody else after I see that we've reached our time limit. But definitely reach out to me. My email is there, and I'd be happy to talk with you further.
Okay, thank you.
Thank you for that terrific question. And Lynn, thank you for that response and your willingness to reach out, because these are such important topics. So I want to thank everybody for joining us today. Any last minute comments or questions before we wrap it up? No? Okay, well, I just want to thank all of you again. Really delighted to have all of you here. And thank you to Anne, Lynn, and Stacey for your wonderful, wonderful presentations. Such important information for all of us to have. And it was just wonderful hearing from all of you. And again, we'll be sending a link out to you soon with a copy of the presentation and also those resources, and you'll be able to watch back if you'd like to. So again, thank you, everybody. Wishing you well, and we look forward to seeing you again sometime soon.
Thanks, Gina.
Thanks, everybody.
Bye.
Bye.